Welcome to episode 11, Artist in the OR, here at Spiro Plastic Surgery, our podcast series. You know, as you all know, facial aesthetic surgery is a big part of this practice, but so is non-surgical skincare. So I decided we're going to do a whole podcast on the med spa here at Spiro Plastic Surgery. Now, we have two very important people here that make our med spa run. Mikayla is our nurse practitioner. She's in charge of our lasers and all of our injectables. Rebecca, she's our skincare expert who does all of our skincare treatments. Together, when you come here to our med spa here at Spiro Plastic Surgery, you are in outstanding hands. They are experienced, knowledgeable, caring, and really skilled. Welcome to episode 11, All Things Med Spa here at Spiro Plastic Surgery.
Hi guys, I'm Mikayla, board certified nurse practitioner, injector, and first assist here at Spiro Plastic Surgery, and I have a very special guest today. I have a very good friend of mine and now coworker here. This is Rebecca, our licensed esthetician here at Spiro Plastic Surgery. Welcome,
Hi.
Rebecca. Rebecca started here in November, so a lot of our patients have already met you, but she is not new to aesthetics, she's just new to Spiro Plastic Surgery. So welcome.
Thank you.
Thanks for being here.
Of course.
Why don't you start by telling us, how did you become an esthetician? Tell us your journey.
So I became an esthetician in 2020. I finished a little bit around the COVID era, so it was a little interesting at that time. But
Fun times.
yes, for sure. But I actually got into the industry back in 2016. I started at my first spa. I was just a front desk associate. I was just trying to make money in college and I fell in love with it. I, of course, started getting facials, so that was easy. But I worked my way up in that spa. I managed that spa for a couple years and learned a lot of the ins and outs of the spa industry. From there, I worked at day spas, I worked at medical spas, and I really fell in love with the medical environment. I just felt like it was more results driven. I was able to actually change people, I guess. Not that I don't love regular facial, I do, and we do offer it here, but I like to make change and I like to build confidence, and I feel like that's really possible in a medical environment.
And why did you become an esthetician?
So I became an esthetician, really, I've always been into skincare, and it was an easy passion of mine to follow. Around 2016, 2017, my brothers, they're not going to love this, but
They are not going to love this at all.
both of my brothers really struggled with their skin. And
I remember.
it just inspired me, I guess, because I really wanted to help them. And I saw not what it did to them, but kind of. Like, it was really it was hard for them, and it was painful as well. My one brother was really into working out, and it was on his back, and anyway, it was just something I wanted to help them with, and I just dove in, and one of my biggest accomplishments in my life is getting 2 teenage boys on a skincare routine, and they still follow it to this day.
Yes, they do.
And then, actually, after I became an esthetician, I struggled a lot with my own skin, so that was a very difficult journey of mine, because I felt like this is my job, and how am I going to help myself? And I learned so much from that experience. And I feel like it made me a lot better at what I did.
Definitely. I think it's hard being in our career when like our skin kind of is going through it.
Absolutely.
And like patients look at you and you're like, I hope that they trust me.
Yes.
Because I'm like going through it right now.
I
Our
struggled
skin's
with
not
it a
always
lot.
perfect.
No.
Right?
We're human.
Yeah, we're human. It happens.
We're women with hormones.
I love that. Let's talk about the services that we provide. So I'll go first. I do a lot of the like advanced techniques. So I do Botox, Xeomin, HA fillers, PRF, the biostimulators, easy gel, and lasers. But we do a lot of combo treatments. What services do you provide?
So, of course, I do a regular facial. Classic. I love it.
Our patients love it.
Yes.
We pamper them.
Pamper them.
Yes.
Love it when someone falls asleep. No embarrassment there. Everyone's
Yes.
always like, I'm sorry. It's like, no, I love
I've
that.
fallen asleep when you gave me a 2-hour facial
Yes.
years ago.
Yes, that's a good time for us.
Yep.
Love a diamond glow. I feel like it can still be a super relaxing treatment, but of course we're using a medical grade device now.
Yeah.
So much better results, more long-term results. Microneedling, a personal favorite of mine.
I know. Love it.
I love it. I do it so much on myself. Like, it is probably my favorite treatment.
I was going to ask you what your favorite treatment was, but you already said it.
I said it. Sorry. We can talk about it. And then just like your classic dermaplaning, chemical peels, all of the fun things.
Okay. And what would you say we do the most like combo? I would say our ultra laser and microneedling probably is like the most combo treatment.
Yeah.
And then a lot of like my Botox patients will come to you for like prepping the skin, like cleaning the skin. And now most of my patients enjoy coming to you more because I cause a little bit of discomfort with
And I cause a lot of comfort.
You do with the massages. So now you're pampering them and they prefer to come to you, which is great.
Yes.
What about how often they should be getting these treatments? Most things are a few times.
Yes, I would say, along with anything, you know, one treatment is never going to change your life. You can't go to the gym one time and expect a miracle.
Exactly.
But I really think that because there's no wrong person, really, for any treatment, it's really just how committed are you to coming in. And if you are the right person for the treatment.
Patients are always asking, like, how do I know if I'm a good candidate? But most of the services that we provide here, most patients
Very
can do
inclusive,
it.
yes.
I mean, there's a few that maybe will make some like modifications, but that's also why I have the lasers that we have.
Yes.
I mean, we pretty much can treat every single person, but I know we've talked about it. The best patient is the patient who is committed and who are going to do consistent treatments.
Absolutely.
Not the person who is going to say, I'm going to try one laser or do one microneedling, and then they don't come back for a couple of months. Like, you need to do the package of 3.
Right. And then that patient will say, I don't like microneedling because it didn't work for me.
Yes.
And they didn't finish. So
It's heartbreaking, too.
It is.
Finish the series.
Absolutely.
You remember the other day I had 2 patients in the same day, and we did laser on them. It was 6 weeks after laser, and they were like, here for the second treatment. They're like, I don't know if it worked. And I'm like, well, you had one. And I showed them the before and after, so you were with me. And they're like, oh my God, it did work. I'm like, yeah, but you're also looking in the mirror every single day. It's hard to see the progress of your skin. But yeah, we like consistency.
Yes.
We like people who are committed. What about a little bit of what each service treats? I feel like it overlaps a lot.
It does, but I
Right?
think that's a great thing. I think that microneedling, because it's my favorite, I'm going to start there.
Yes.
It's good for everything. Anyone over the age of 25 could benefit from microneedling. It's a collagen builder. We're all losing collagen at a rapid rate sometimes.
Yeah.
So we want to be on top of that.
Yeah.
I think that if you can, in a perfect world, a facial should be monthly.
I know.
It really should be monthly, just to
Really clean your
resurface
skin.
the skin.
Yeah.
I just can do more than you can do at home
Yeah.
on yourself, and that goes for myself as well.
Yeah.
Like, I can't give myself the service all the time that I give to
Yeah.
other people.
Oh, of
So
course.
I would say monthly in the sense of a facial. Chemical peels, again, monthly. I feel like really every 4 weeks our skin needs to turn over, and sometimes it needs help, and that's what we're here for.
Yeah. I would say for my lasers, I usually do 3. They could do like 3 a year. It's like every 4 to 6 weeks. They sometimes might need more than that. But that's a little bit more like aggressive.
Yeah.
And then obviously your Botox every 3 to 4 months. Usually I'm doing filler yearly. We're like doing a little bit of touch-ups. But I feel like patients should be coming to see you more consistently than me. Definitely.
Yes,
You're the
absolutely.
foundation. The next thing we're going to talk about is going to be very exciting. Skincare myths. And some of these I've been very embarrassingly, like I have believed them for a very long time. So let's talk about the first one. Oily skin does not need moisturizer. This is something I definitely believed for a while.
I understand
Yeah.
why that's a thought.
They're like,
to
my
people.
skin is moisturized.
Is moisturized.
Too much.
And to an extent, that's not completely wrong.
Yeah.
Because when our skin is producing oil, that's its natural way of moisturizing
Yeah.
itself. The problem with anyone not using moisturizer is our skin becomes confused.
Yeah.
And it produces more oil when that's not the intention and likely not what you need.
Yeah.
And It just is not going to keep your skin balanced in that way. And we need to hydrate the skin. It might not be the moisturizer that a dry individual would use, but we need a moisturizer all the time.
We do. What about dermaplaning makes hair grow back thicker and darker? I'm sure you get that every time you dermaplane.
Almost every time,
Yeah.
especially a first timer. I've had people ask me after I've already done
Yeah.
it, which I think is very
Yes.
interesting. You really trust me
Yeah.
at that point, but it's scientifically impossible. You have to hit the root of the hair to change the way that it grows, and I'm nowhere near that area. I've been asked, well, when you shave your legs, like maybe it grows back a little different.
Yeah.
I would really hope that the hair on your legs is not the hair on your face. It's
Yes,
not
exactly.
even
It's very
close
different.
to
Yes,
the type of hair.
Exactly.
On our face, it's vellus hair.
Yeah.
You were born with that. I cannot change that.
Yeah.
No part of me can change that for you.
Yeah. So everyone should dermaplane.
Everyone should dermaplane.
I did. I was doing someone's Botox the other day. I said, "Did you meet Rebecca?" And she's like, "No, I wanted to." And I was like, "Oh, you should do like, customized facial, dermaplane." She goes, "Are you saying I have hair on my face?" I go, "Oh, everyone does."
Everyone does.
She's like, "I know, I needed to." She did book. Let's do the next one. You don't need sunscreen in the winter. This is a big one that I have because like all of my patients, I always try to get them on the sunscreen, especially for the lasers.
Yes.
And they're like, "Well, what are you wearing right now?" And I'm like, "Sunscreen.
Yes.
That's my makeup. I wear sunscreen." Like, "It's raining outside." I go, "I know. I wear it every single day." So why would we need to wear sunscreen in the winter or on rainy days or when it's snowing?
Even if it's realistically, I wear sunscreen when I'm going to the gym and it's dark outside.
Yeah.
I'm going to leave the gym and it's light outside.
Yeah.
Anytime your skin is exposed to the sun, the light, there is UVA, UVB. And no matter what time of year, we have to protect ourselves from that.
Yeah.
The sun is not taking any days off from shining. So
It's very true.
it is. And we cannot take days off from protecting our skin.
Yeah.
If you have any slight concern about anti-aging, preventative aging, and you're not wearing sunscreen, there's almost nothing that we can do for you because
How do
you're
you
not
feel about the
protecting
SPF
yourself.
in the makeup?
I'm
putting you on the spot.
diluted, like
Yeah.
not the best,
I
but the
know.
thing is, I would take it.
It's better than nothing.
It is better than nothing.
Yeah.
I think there's a lot of alternatives nowadays
Yeah.
to sunscreen makeup that are not makeup with sunscreen, but they're sunscreen
Yeah.
with makeup.
Yeah.
And that I'm a huge, huge fan
Yeah.
of. I think it's better for the skin.
Yeah.
The skin can breathe and it looks
better.
more natural.
Yeah.
And it doesn't feel as heavy.
Yeah.
A lot of people hate the heavy
A lot
feeling.
of people love switching from their foundation to a nice tinted sunscreen.
Yes.
That's what I've been doing for
Yeah.
all of our patients, and they love it.
Yeah, absolutely.
It's a good one. Anti-aging products are only for people over 50 because, like, why else would they need it?
Kind of silly.
I agree.
I think that anti-aging and preventative aging are often confused.
Yeah.
They're very different, and I don't think you will need to do as much anti-aging if you preventative age.
Exactly.
So, of course, you can wait until you're 50 if you choose to do so, but you're going to be playing a lot of catch-up.
Yes.
And that's not something you have to go through.
Yeah. And it's usually doing a lot of multiple modalities. You're doing Botox, you're doing resurfacing,
Yes.
you're doing your facials. You need to be a little bit more aggressive. Then you're also focusing on volume loss. You need HA fillers. You need a lot more.
Yes.
I think we're seeing a lot of more younger people come in now for preventative,
Yeah.
which is great.
Yeah.
What about, speaking of anti-aging and aging in general, you don't need retinol until you're 50.
Again, kind of silly. Retinol is really going to help us with our cell turnover, fine
Yeah.
lines and wrinkles. It's going to help with collagen, elasticity, laxity of the skin. If we're starting that when the skin is already that way, it's again playing catch up.
Yeah, it's harder.
When we don't have to go through that. I will never forget a training that I was in, and I was maybe 18 or 19 years old. And that was when I had first learned when you start losing collagen.
Yeah, and it's
And
scary.
I bought a retinol that day.
Yeah, it's scary.
Yes.
I know. I think for me, when patients come in and they're very overwhelmed, like I start them with like a retinol and a growth
Yes.
factor, something
Yes.
small, but everyone should be on a retinol.
Absolutely. And sunscreen.
Yeah, and sunscreen. Sorry. What about exfoliating? So exfoliating every day is beneficial for all skin types. I can't do that.
You can't do that.
I can't do that.
I would want to start debunking that by saying nothing is for all skin types,
Exactly.
realistically.
Yeah.
Maybe a gentle cleanser, but
Yeah.
like not something to that extent.
Yeah.
Personally, I can exfoliate every day.
You can.
But with that being said, I don't If
Yeah.
I feel like my skin can't take it, I don't. And
Yeah.
I think a big part of that is listening to your skin
Yeah.
and doing what you need in the moment.
Yeah.
I am pretty consistent with my routine, but of course I change it when
Yeah.
it's necessary. But, there's nothing that
Yeah.
is for all skin types. So
Yeah. Well, I think that's why it's
Definitely.
important for patients to see you because they need
Yes.
to learn how to learn their skin.
education
You know what
is
I mean?
such a
Yeah.
big part of my
Yeah.
job, and I really enjoy it. And I think that it's very obvious when I'm doing a consult or something like that I do enjoy educating people.
Yeah.
And it's the
the
only way
best.
to
I love
commit
it.
to something, though.
Yeah.
Skincare products are expensive.
Yeah.
And I want you to understand why you're spending this
Yeah.
money
How
and
the
what it's
products
going to do for
work.
you.
Yeah, exactly.
Yes.
What about, can you shrink your pores? I think you were with me. I had a laser patient and she's like, you shrunk my pores. And I'm like,
I wish.
I wish I did. And I'm so happy you think that. I did
Yes.
not.
No.
They appear better.
Yes. And I think that's the key. We can change the appearance of
Yeah.
them. So why would we not? Of course we
Yeah.
want smaller pores. That's what gives the glass skin look that
Yes.
everyone's looking for.
Yes.
But your pores are genetic. So you can thank your
Yeah.
parents for that. But we can change the way that they look. And I think that is something that people should be focusing on because it keeps them clean and
Yeah.
it keeps your skin functioning in a healthy way.
Yeah. What about more products equals better results?
I don't think more of anything would be a better result if it wasn't a part of your plan or your
Yes.
skincare routine. I'm a big believer in quality over quantity.
Mhm.
I personally don't have a massive skincare routine. I
neither.
feel like a lot of people would assume that I do because
Yeah.
of my job.
Oh, 100%.
And I don't. I don't have time for that. I think it's a waste of time. It's a waste of money
Yeah.
when you're layering on serum 3, 4, or 5.
Yeah. How is it
Nothing is
penetrating?
sinking into your skin.
Exactly.
It's not.
Yeah.
That's when people are like, I don't like this because it's pilling on my face.
Yeah.
What layer is that? And I really would just rather have 1, 2, 3, maybe if you convinced me that they could layer together,
Yeah.
would be great. And I just don't think it's necessary to do more than that.
Yeah, it's funny because when I tell patients, "Oh, I'll be right back. I'm going to bring in Rebecca. She's going to go over skincare products." They're like, "Oh my God." I'm like, "No, she's not going to put you on a 10-step skincare
No.
routine." And they're like, "Okay."
And I think people, when I ask, I start every facial asking about your home care routine
Yeah.
because I need to know, of course, what I can safely do on you.
Mhm.
And everyone is almost embarrassed to say,
I know.
I don't do a lot.
I know.
It's really simple. And
I'm like,
always
"Me too."
That's great.
Yeah.
That's
it's
keep
fine.
going. That's exactly
Yeah.
what I want to hear.
Yeah.
You know?
I know. Okay, let's talk about why skincare is so important and how this complements injectables. How I tell patients, because when I do consults, I'm looking at skin, bone loss, fat pad distension, and I'm looking at muscle. The skin is the foundation of your face. If you don't have healthy skin, you are not going to have the best result. And patients are like, well, it's just these wrinkles and things like that. But I have early on, this really stuck with me, and then I really started to invest more in patient skincare. I had a patient who was in her late 40s. She had a lot of volume loss in her mid face. So she started getting a little bit of hollowing in her cheeks, and we did mid face restoration. So I did a great job of cheek filler. She had a great bone structure, but then when I was looking at her, the light was just not reflecting the way it should be after filler. So it should have popped out a little bit, and it was because she had so much sun damage on her cheeks. It still looked like she had that indentation in her cheek just from her eye to lid cheek junction, and it's because of the pigment. And I told her that, and she's like, no, I think it still needs to be filled. And I'm like, no, it's because look in the light. And I tried, because this was even before we had lasers, I tried to get her to do chemical peels, and she would not do them. And it was maybe, I really should treat them before.
Yes.
And which is oftentimes what I do.
Yeah.
And I think people are now, this was years ago, people are now more involved in skincare.
Absolutely.
But it just preps your skin for those procedures, I think.
Totally. And I also think that you really can't do one without
No,
the
you
other.
can't. You can't.
They go together for a reason.
Yeah.
They are both a service and a med spa
Yeah.
for a reason.
Yeah.
And I think that your skin, it's the largest organ on your body.
Yeah.
Let's be real, we really have to invest time and money into that. It's the only one we're going to have. But I also think that it's just your first impression.
Yeah,
That's what
it's
you're going to
true.
see
It's
first.
true.
I could look at you really hard and be
Yeah.
like, her forehead's not moving. She has Botox.
Yes.
But I'm going to see your skin first.
Exactly.
And I really don't think that someone would be able to get Botox only and be completely
100%.
happy with their results.
100%.
I think Botox is working on a muscular level.
Yeah.
And while it will help relax that muscle, it'll stop the wrinkle from forming. If it's there,
it's there.
it's not going to.
I have that
It's not going to get rid of that for you.
I have that
That's
conversation so
skincare.
many times. I know.
Yeah.
And patients are like, well, Botox. Like, I just want Botox. I'm like,
Mhm.
okay, but that line is there.
Mhm.
So, like, we're going to prevent it from getting worse with consistent treatments, but it's there.
Yes.
So it's because in your 20s, like, you had that collagen and elastin.
Right.
So now you don't have that.
Mhm.
So you need to do those treatments.
Exactly.
It's a long discussion.
Yeah.
So speaking of the services that we provide, let's give an example of a new patient that came in and how we both kind of like tag team.
Mm-hmm.
So we recently had a patient that came in. She had some old filler dissolved elsewhere, and she's concerned about overall collagen loss, fine lines, under eyes, and just wants to like have more like healthy skin. Her daughter's getting married soon.
Yes.
So for that patient, we put her on some skincare.
Mm-hmm.
I think we put her on retinol, probably growth factor. You did that.
Knowing us.
You
Yes.
knowing us, yes. I did Botox that day.
Yes.
And then she's coming back in. Anytime someone gets Botox that day, I usually tell patients they can't really do a skincare procedure afterwards for about 2 weeks,
Yes.
unless we do that skincare procedure 1st.
Mhm.
So like microneedling, a laser, then we could do Botox after.
Totally.
She's coming in because she has some collagen loss, fine lines, wrinkles, texture, but pigmentation.
Yes.
She's done microneedling in the past and has loved it. So we're doing microneedling. So you're going to do microneedling on her.
Yes.
And then right after, she's going to come to me. And I'm going to laser her, and I'm going to do the ultra laser, which is really, it can be a very gentle laser, but also pretty aggressive. For her, I'm going to use it a little bit more gentle, more surface level, just to get the pigment to come off. And then we're also going to stack PRF Easy Gel. We're going to do a little bit of under eye restoration with the Easy Gel. Easy Gel is a 100% natural biostimulator taken from your own blood, no additives in it. And that's why I think our patients love that. They prefer that. So we're going to use that in her under eyes and cheeks just for a little bit of volume, but more to enhance the skin, overall like skin texture.
Yeah.
And she's going to continue to come in every 4 to 6 weeks for her microneedling and ultra. She's scheduled for 3. And then she'll continue to do her Botox every 3 to 4 weeks, 3 to 4 months. And then we'll go from there. After she does her 3 treatments with us, I usually tell patients to keep up with skin.
Yes.
So what about bridal prep and, you know, mother of the groom or mother of the bride? What else would they have to do?
I feel like you can't end necessarily after your 3 treatments. Like,
Exactly.
It's just not necessarily going to be complete. I think that's where you will see a big change, which I think is motivating to keep going. I think especially talking about a wedding, a bride, a mother
We have a
of
lot
the bride
coming
or
up.
groom.
And usually they come in like a year before, which is ideal.
Which is great.
Yeah.
You want to give more time, especially if you have things that you want to work on. But even if you don't, it takes time to build up healthy skin.
Yeah.
And a huge thing for brides is increasing hydration in their skin, because you're going to be wearing a lot of makeup, likely not what you're used to wearing, and it will not sit nice if your skin is dry. So I definitely like to focus on hydration.
And how do you do that?
Probably a Diamond Glow.
Yeah.
Diamond, you knew that.
I learned that. Yep.
Diamond Glow is going to exfoliate, hydrate, and it really is just so all-encompassing of a treatment.
Yeah.
Like, it does so much at one time, and I find that that's why people come back. I don't really have to convince you to come back. You really just
once they've
see
had it,
and you're like, yeah,
they're
I want to
hooked.
keep doing that.
all of our laser patients, I always offer them the first Diamond Glow, and they're hooked.
Yeah.
They love it.
Yeah.
It just gives them the extra glow.
Yeah.
With the Ultra, I mean, you see your glow. You see that pigment come to the surface after 7 to 10 days. But like with the Mosaic, and even with microneedling, you don't see your result right away.
No.
Because it does not take collagen 1 week to start remodeling. I mean, you see that over the course of like 4 weeks, you might start seeing your result. I tell my patients for Mosaic, it could be up to 3 months to really start seeing your result.
Yeah.
So.
Even after your last treatment.
Oh, yeah.
Like, it's still working.
It's still working.
I would hope that after 4 weeks, it's not
should.
like done.
No.
Collagen's
No,
done
it's
producing.
still going.
Yeah.
Mm-hmm. All right, that just about wraps it up. Thank you for joining
Thank
me.
you.
And if you're still here, thanks for watching. Be sure to follow us on all of our Instagrams that we'll put on the screen. See you next time.